We will get started with our meeting at 19:03. Or my phone says, Verizon says 1900, so we're on time. That went fast. Like to welcome you all. It's been a few months since we've last seen you all. I just want to make sure everyone is signed in, correct? All right, so we'll talk about the agenda. We're gonna go out of order in the agenda that I sent out yesterday evening. We have a CON action to start, so we'll handle that after we call the meeting to order. We will call the meeting to order. We will then turn it over to the CON committee to talk about the CON. It's the city of Lockport moving from a muni to a full CON. And then we will go through all the stipulations that Rick has to read out loud. So a lot of this is just pro forma stuff that we have to read. If you feel that you have a conflict, when Rick lets you know, please let us know if you have one. We'll determine if you have one or not as a group, and then we'll move forward and take the vote. Does anyone have any questions?
Do we have 16 people?
We do. We do. And so I want to make sure everyone has signed in that is here tonight. Right? Perfect. All right, I'd like to call the meeting to order at 19:01. Can we please stand for the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty.
And at this time, we're gonna suspend our regular order of business to move to new business order for the city of Lockport CON. We have a stenographer here. If you have any comments to make during the discussion period, please state your name in full. And would you like them to spell their first and last name if they speak?
Yes.
Excellent, thank you. We will go through that process, so please speak clearly, loud, spell your name for the stenographer. All right, Rick, here we go.
Okay, so we're here tonight to review and vote on the CON application for the city of Lockport Fire Department. The committee received the application. It then was forwarded to the council, or to the CON committee. The CON committee reviewed the application. We found deficiencies. Letter was sent to the applicant stating the deficiencies. Paperwork was obtained regarding them and forwarded back to the CON committee. At that time, the committee deemed the application complete using policy statement 0606. The applicant was also forwarded to Department of Health, New York State EMS CON Bureau for fitness and competency. That was cleared with no findings to stop the application. After that, the public hearing was issued. We set a date with the applicant, with chief. And notice of public hearing letters went out to 24 agencies involved in the application. We had the public hearing on August 26th in the city of Lockport with a public hearing officer. And also the hearing was also transcribed. At the end of the public hearing, the hearing officer or the lawyer wrote his report on the findings of the application. And we have a copy of that. And I believe that was all sent to you by email. Okay. Do we have any questions or comments regarding the application and the findings? Okay, so with that said, we, the CON committee, find the application, City of Lockport Fire Department, to be complete.
Yeah, so before we do that, we just have to read.
So as we vote tonight, The New York State EMS Council has requested a clarification of the voting requirements of section 3003, paragraph 5, which outlines the certificate of need process for regional EMS councils. The following opinion was provided and approved by the Bureau of House Counsel. The quorum is defined as a majority of the whole number of voting members of the council who must be present at the meeting in order to conduct business in which a vote is required for statutory authorized business, such as a CON. If the council has 30 voting members, then 16 would be needed to be present at the meeting in order to have a quorum. Any voting member who abstains from casting a vote is still counted as a voting member in attendance at the meeting to determine if a quorum is present. Therefore, 16 voting members were present at a meeting of a council of 30, and one member indicated they would abstain from voting. You would still have a quorum. In order for a motion or a resolution to be passed, it must be approved by not less than the majority of the whole number of members authorized to vote, not just those members present at a meeting. Thus, if a board is authorized to contain 30 members and 16 are actually present, there is sufficient attendance to constitute a quorum and business may be conducted at the meeting. However, any issue which did not receive the vote of any one of those 16 members would fail because the minimum vote needed to pass a resolution or motion is 16, the majority of the body's total authorized membership. Members who abstain from voting or who are disqualified from voting still count as making up part of the quorum. But for the official action of a board or council, actual affirmative votes constituting majority of the body's authorized membership must be cast. Also note that if determining a majority, the whole number of members includes all those positions authorized to vote, including vacant positions and those who may be disqualified, absent, or abstain.
At this time, we'll invite Chief Luca to speak to the council.
Good evening, Luca Qualiano, LUCA QUAGLIANO, Fire Chief of the City of Lockport. I just wanted to express my appreciation and gratitude to everybody that's helped us along the way in this somewhat arduous process at times, but you know, we've had a great support system, we've had a great community backing, we've had great mutual aid partners that have helped us get to where we need to be here. So I just wanted to thank you all for your time and your efforts and your support in this process. So thank you.
Thank you, Chief. At this time, does anyone have any questions, as Rick stated, regarding the City of Lockport CON? We'll read the findings of fact from the hearing officer. Rick, do you mind doing that? Yep.
Findings of fact. The application of the City of Lockport has been submitted on the prescribed form as notarized and affirmed. The application is accompanied by all the required attachments, endorsements, evidence, and other supporting and explanatory material described by the applicant of the regional council to consider. The application and narrative thereto describe the proposed area of service, level of service, hours of operation, service location, and other pertinent operational aspects of the new service proposed. The applicant describes the source of funding, the adequacy of sources of future revenue, and provides a budget for the proposed service. The applicant allows a reasonable assessment of the financial stability for the applicant to provide the proposed service and the financial feasibility of the proposal. The applicant includes attestation to the competency and fitness of the applicant and affirmations to competency and fitness. Department of Health Form 3778 have been provided as part of the application. The applicant has sufficient knowledge of the EMS system in the area to be able to describe the positive and negative impacts the applicant's change of service will have on the area and providers. The public application and hearing process has obtained input from those who use, provide, pay for, or compete in the EMS arena. The applicant also has solicited letters of endorsement from all EMS and ambulance service agencies licensed to provide service in the area together with other relevant parties. The letters of solicitation include a general description of the new service, the type and level of service to be provided, the definition of public need, and a request for response by a specified date. The letters in response to the applicant's solicitation have been signed by the CEOs of the organization or organized designee. There have been no objections made to the application by any person or entity. The application includes a copy of the letter of solicitation, a list of agencies, individuals which meet, and it was sent and any response received. The regional council set a public hearing date of August 26, 2024 at 6 p.m. in the city of Lockport City Hall, 1 Locks Plaza, Lockport. The notice of public hearing was published on August 14th. That was published in the newspaper designated by the Regional EMS Council to receive legal notices, and such publication was at least 14 days prior to the hearing date. The notice of public hearing included the date, time, location of the public hearing, a solicitation of response to the application by a specific date, and provided a mechanism for any interested parties to obtain and review the application. The public hearing was held on August 26, 2024 at 6 p.m. at City Hall, City of Lockport, pursuant to the notice of the same. Stenographer recorded the proceedings of the public hearing. A true and accurate copy of the same is annexed here too and made part of the record as though forthwithly set forth. The undersigned public hearing heard witness, received written statements, asked questions, and accepted testimony and documents at such public hearing.
If you just want to read the recommendation.
Recommendation, based on the foregoing and all the evidence before me, I hereby recommend the application to be approved. Signed, Mark Butler, hearing officer.
Thank you, Rick.
At this time, we'll entertain a motion off the floor. Steve,
So moved to have this application approved.
second
Second.
by Emily.
I have a question.
Discussion.
John Durand, normal spelling D-U-R-A-N-D. Unless my math is off, and it's been a long time since I've taken math, on item 14, August 14th is not 2 weeks before August 26th.
Okay,
It was published on August 14th.
The letter of public hearing was sent and received to the newspaper on the 12th.
Okay, that's not what it says here. It says that it was published. Such
As
publication
soon
was
as they could
released,
publish it was the 14th.
right. Which is at least 14 days prior to the hearing date. 26 minus 14 is 12.
Let me see. Do that. That's the date of the ordinance. Started in. Started this up at 8:14.
She received it at 11:50 a.m. on the 12th.
your point is noted. It's the Union Center Journal out of Lockport. Chief, I don't know if you can answer this, but how often do they publish the paper in Lockport? Is it every day?
Daily.
Except Sunday, right? We're still doing Mondays or Saturday. Yeah.
I just don't want it to get hung up further up the line, you know.
Sure.
They received it on the 12th.
Yeah. Yeah. It was received, I mean,
As soon as she could do it was, but she received it on Monday.
there was, the public hearing was held and nobody spoke in opposition of it.
Yeah, I have no problem with
Yeah,
I'm just trying to make sure that
Yeah.
it goes up the line.
so noted, we noted that. Any other discussion on the CON? We should just try to talk a little bit about it, just other than, I mean, Chief, you're welcome to talk again, but anyone else that is here to talk about the reasons why it might be good, might be bad.
This is not scenario for me, the full names of the motion, mine, maybe.
Yeah, it would be Steve,
Cooley, Coley, first name Stephen with a B.
Emily James seconded. EMILYJAMES. Did I get that right?
Common spelling.
Go ahead, Chief.
Luca Poliano, Aquafire. So just to give you a little information about the volume that we've experienced since operation. We went live February 14, 2023. For 2023, we answered 3,309 EMS calls, 2,350 resulted in transports. To date this year, we've answered 2,900 EMS calls, 2,110 resulted in transports so far. So, I mean, the volume is certainly there for the agency to need the service or need to provide the service rather. So that gives a little bit more information for the record.
Thank you, Chief. Does anybody have any other comment? Questions? Thoughts? Have a chance to speak?
Well, if the surrounding EMS services have no objection, and we know that there's a shortage of EMS workers and EMS services, anything that can be done to improve the service for the city of Lockport and the surrounding area, because other units won't have to be into the city to cover calls, seems like that should be a good thing. If there were complaints, that would be something different, but since there's no complaints and everybody seems to be improve the situation, I think we ought to go ahead and improve the CON.
Thank you. I'll ask the first time, does anybody have any questions or comments they'd like to make? I'll ask the second time, does anyone have any questions or comments they'd like to make? I'll ask one final time, does anybody have any questions or comments they'd like to make? John, can you proceed with roll call vote, please?
Sure. We'll start with Niagara County. David Cole.
Yes.
Sandra Dicer.
Yes.
Tom's here. Tom's here.
Is it?
Yeah.
Oh, that is the senior. Okay. Tom Egger.
Yes.
Emily James.
Yes.
Andrew Knoll.
Yes.
Sarah McCartan.
Yes.
Sherry Rachel.
Yes.
Jonathan Schultz.
Yes.
Chad Shepherd.
Yes.
Dr. Naveen Seth.
Abstain. Yeah, so we have all time. Yeah, with just a all time, we don't have.
Genesee County. Rick Renee.
Yes.
Sean Downing. Yes. Jonathan Duran.
Yes,
Wanda Irwin.
Yes.
Brad Nickerson.
Yes.
Christopher Scapano.
Yes.
Robert Tedford.
Yes.
Brianna Smith.
Yes.
Yeah. Bob Youngflesh.
Yes.
Still,
Just one because.
oh, she's missing.
Yeah.
Then we have Terry Thompson.
Yes.
David Birch.
Yes.
Scott Balkin.
Yes.
Brianna Cadwell.
Yes.
Fred Payano.
Yes.
And Steve Cooley.
Yes.
Is there anybody that didn't sign in yet? We'll have you sign in. If anyone's questioning why, if you're an alternate in the county and why you didn't vote, the bylaws state that if all the delegates show up, then, for that county, then they're on, so all 10 that are on the ballot for Niagara County were here. And 9 for Genesee County, and then Orleans had 4 or 5. The 25 yeses, 1 0 no's, and 1 abstention, so the motion passes and carries. Chief will write a letter, Rick will write a letter to the state, and probably have your CO in a day or 2.
It's a
Congratulations.
state.
Oh. No, there's no under new business. What was reason?
Yeah, we're good. Bear with us a moment. Yeah, and then
I'm proud to say that we beat the public hearing by like 20 minutes. And we have a lot more people here.
I have a suspicion that Butler costs more than she does.
Why is that?
I have a suspicion that Butler costs more.
Just a little bit.
a normal fee.
Yeah.
Yeah, I'm gonna transpose it. Everything else is.
All right. We will get started with our resuming our order of business. The question is can I get this done in 30 minutes? So, yes, because I'm hungry and want to go. Dave doesn't care. Dave's on the clock. Dave's here till 7. All right. So I'd like to make a motion to approve, Sean put March's meeting minutes in the back there. If you haven't taken a look at those, they're back there. just like to entertain a motion to approve those minutes, and then we'll get caught up with June's and, motion by Terry made it first, second by Bob. All in favor? Any opposed? Any abstentions? Perfect. All right. First, I want to welcome Zach Palvino from UBMD. Zach replaced Mike Shaw, who left in June to go to work for Wyoming County. So I'd like to introduce Zach and welcome him. Zach will be a friendly face, just like Mike. We'll have a nice shortened report here in the next little bit. But I'll let Zach, introduce himself, say hello, and, give you a chance here to talk for a minute or two if you'd like.
Sure, so, thank you, everybody. So yeah, my name is Zach Bulbino. Started in August, with UBMD. Been provider since 2005-ish with Snyder and Amherst. So looking forward to this next chapter in my career. So, I've probably sent a bunch of people emails so far, looking for some data to put into some spreadsheets, but, look forward to working with this group.
Thanks, Zach. Welcome. All right, moving along, chairman's report. CMAX REMSCO, the next meeting will be held December 3rd and 4th in Troy. As I always tell you, if you ever have a chance to go out there, please do so. If you need to pick a day to go out there, pick Tuesday. That's when all the committee meetings happen. That's when you're able to get a greater peek behind the door. If you go on Wednesday for the CMAX REMSCO meetings, you'll get to see the Med Standards meeting in the morning. And you get to see the CMAC. However, little side note, the CMAC and the SEMSCO is live streamed, so you're able to watch that at home or at least on your travel back, instead of spending 2 days out there. Troy's nice, gets a little hairy in the winter, but you just can't walk too far from the hotel. But we were in Saratoga Springs last week, so we'll have a bunch of updates on that. So Grants Gateway, it's no longer called the Grants Gateway. It is called the state financial system. So we're transitioning over there. Long story short is that the executive committee has met, and we've decided that we are going to bring the SFS back into in-house. We're no longer going to contract with somebody to provide that service for us. That way we can start to streamline it. Colleen and Lake Plains helped us when we needed it the most. However, some things have changed, circumstances have changed. So we need to bring that back in-house for us to control. Our plan will be to one, transition a statewide financial system. We haven't done so yet. And then as we do that, we will write a how-to manual for people who will succeed us in years to come, so they can just kind of follow that rule book and continue along the path that we need to continue on and not use an outside vendor. Any questions about that? Regulation changes. The education regs, as everyone knows, finally passed. They're all in effect now. I'll mention here in a little bit, but the education group with the state has put together an education change log. So it's policy 2408 that I sent out the other day, and Rob sent out, or Zach sent out previously. That outlines a lot of the regulation changes or definition or terms that have changed since the new regulations have taken place. So that's a good manual. It's worked well with the collaborative protocols so that people know what's changed from previous protocols. We hope this will do the same. So if you haven't had a chance to, I highly encourage you to read that or reach out to Zach or Rob, and they'll help you kind of through that process. Some of the big changes that we've noticed out of that is that certs are now 4 years. So anybody is recertified after, was it July 31st has a 4-year cert. You no longer have to be affiliated with an agency to do CME. You just have to find a CAIC to sign off on that for you. The only thing the group won't be eligible for would be the reimbursement for that.
Yeah, and you also still, if for ALS, you'd still need a medical director to sign off on your skills.
Dr. Suff, I think would be more than happy to. Moving on, the equipment regs. So everyone has seen that those went out for public comment in July. The public comment period closed last week. This will come as no shock. People were very opinionated about these. There were a lot of questions that were written. that the state will have to, and the SEMSCO will have to go back, review those questions, answer those questions or clarify in the reg. Some regs will have to be changed, and then as no surprise, those will have to go out for public comment again. Which means another 60 days before those would be approved. So the hope is that the education or the equipment regs will go back out sometime in late November or early December, which would put the 60-day mark somewhere into early February. There is a CMAX SEMSCO meeting in February, however, depending on when that comment period closes, probably will not be, will probably be too close to the date, so we're looking at the May meeting for those regs to get approved at the SEMSCO. So obviously, thank you to everyone who's commented on those. Comments are definitely being reviewed. And hopefully the regs will take place in 2025, so we no longer have to carry urinals and bedpans and pillows and some other little things that are on there as well that are kind of nuisance. Vehicle standards. The vehicle standards are still in the regulatory writing process. The hope is that those will go out sometime in October, or November. We believe we have a lot of the linguistic issues that arose, with some phrasing, that was originally voted on and approved to kind of smooth that over. And so we believe we're in the home stretch with those, so hopefully those will come out. So that's ambulance vehicle construction that will come out. I just want to remind everybody that once the equipment regs are passed, there is some onboarding time to become compliant with them. It's not just a flip of the switch and you have to be compliant with everything that's in there. Some you'll have to be compliant right away. I think most of those we already are. Some will have a 6-month onboarding process and some will have a 12-month onboarding process. It's been so long, I don't remember what those 6 and 12-month things are, but once we get close to approval, I will make sure to remind everybody. EMS legislation. 3 pieces of EMS legislation that we've talked about previously. First is TIP and TAD. So TIP and TAD relates to Medicaid reimbursement for agencies. Thankfully, the governor signed this law last week, Wednesday, and prior to October 1st of this year. If she would have signed it anytime after October 1st, we all would have had to wait until next October for this law to potentially come into effect. Good news is the law is now signed. Come October 1st, this will go in as a law change and the state can begin to work on it. What does the state have to do? The state has to create a state plan amendment, or otherwise known as a SPA, to CMS with the federal government to allow higher Medicaid dollars and to allow for us to bill for treat in place and transport to alternative destinations. Agency specific, for those of you that bill, some key things to keep in mind is that you'll want to make sure your QA/QI is on top of that and you're documenting appropriately to make sure that you're not going to lose out on those dollars as they come through. That's going to be the most important thing. The other thing that we will have to do as a region is we will then have to approve alternative destinations that we can transport to. It's not just you get to pick one and just go. We as a region have to approve those. We can approve all of them. We don't have to approve any of them, but we'll have to go through and approve them. I know Rob has been working on a list for a few years now. Pretty much started under the ET3 model, as we were hoping that was going to be something in there. But obviously it was not. So once we get closer to that, we will have to approve those and send them off. So that one, because they have to be in the schematron and have to be in the state database to receive PCRs and for you to receive your reimbursement. So a lot of work to be done. So we'll keep you updated as we go. One of the biggest things that you can do now is, I don't want to tell anyone what to do, but, federal senators and assembly men and women, reach out to them and try to get the state plan amendment approved as soon as possible. I don't foresee this being an issue, but you never know because it's out of the state's hands and the federal government at this point. So who knows at this point. And then, ground ambulance, the governor also signed, ground ambulances are able to carry and transport blood products. Now, this will come as no shock, so this is good news. However, does everybody know who Wadsworth is? Those of you that work in hospitals probably do, or, this will come as no shock that Wadsworth wants things done a very specific way and, makes it very difficult for, and money and transporting agencies to kind of work through and do this. So the good news is that the law is signed. But there's a lot of stuff to be worked out on the back end with Wadsworth, because you have to be affiliated with a lab. And so those of you that are able to carry it, good luck. I know Mercy Flight carries it down the air side, which has been a little bit easier. Basically, they just cut paste the air side into the ground side pretty much and said, "This is good." There's some other things on the ground side that we need to take and think about, right? One of the big issues that Wadsworth has is supply of blood. Which I can understand that, right? Obviously, if you live in an urban environment, is it prudent for agencies to carry blood? I think you can make argument both ways, because when you need blood, right? But you're also so close to a hospital. If you're an hour, hour and a half, 4 hours away from a hospital, I think one can see an argument that maybe those agencies should carry blood out there. However, those agencies that are probably out there are probably smaller departments that don't have a budget that will allow them to carry it. So a lot of things to be worked out, but we'll see how that works out. And then one of the big things that came out of innovations at the REMSCO and CMAC meetings was that there is now an approved definition of EMS. And I will read that for everybody. Emergency medical service means a coordinated system of interoperable healthcare response, assessment, treatment, transportation, emergency medical dispatch, medical direction, research, and practitioner education that provides essential emergency and non-emergency care and transportation for the ill and injured, and enhances preparedness and mitigates risk to the public. So that is something that has came forward and voted on at the REMSCO last week. This language has come from all angles of those that have been working in EMS. It comes from a lot of trade associations, NYSFERA, and others. Don't be surprised that this language you will start to see in the governor's budget going forward for approval of different EMS initiatives and things that will go to the governor and hopefully be codified as we finally have a definition of EMS. Does anybody have any thoughts or questions? Once it gets sent out fully, I will send this out to everybody for them to read and chew on. But if you have any comments, let me know. Does anybody have any initial thoughts about it? I think it pretty much encompasses a lot of the things that people worry about. There was one small change from Tuesday and Wednesday's meeting, if anyone is worried. The one word that they wanted added was research. And people were like, we're really gonna hold this up for research, just put research in there. And then the argument was, where in there does research go? It's just a comment, doesn't really matter. Like the first thing in there is not the most important thing. So this will probably start to shape and define questions regarding reimbursement funds and everything else that comes. So start thinking about that and, you know, maybe start using it with your local politicians and things like that. Training in it. So some of the stuff that they talked about there, the PSI exam, one of the things that we've noticed or seen, when your students take their exam with PSI, they're supposed to get a printout that has their score on it with their picture that says that they passed, and they can use that as part of, you know, that is their certificate until they receive their certificate in the mail from New York State, like 9 years later. The one thing that has to be on that paper is it has to be watermarked. So if it's not watermarked, the state does not recognize that as a certificate that you can use to operate. Because your score doesn't go into the state for 7 to 21 days, usually 21.
Are people trying to do counterfeit?
No, so this was a PSI issue, is that, so this is. Certain PSI sites will just print your scores, not realizing on the fine print. That's actually, if you look at your certificate out there, that says it has to be watermarked for you to practice it. Once the state was notified, they worked out the kink with PSI to make sure that they did that. But it's also incumbent upon the students to make sure that they can easily go, hey, I need something that's watermarked, and they'll print a new copy out, but they just need to ask, just something to kind of be aware of and think about. Because you don't want Lisa knocking on your door. And then also too, this will come as no shock that, Kevin Lynch and Drew Chesney have been working with PSI to cut down on the issues with PSI. And a large majority of their time originally spent on this was, 3 to 4 hours a day, every day. They're down to about 3 to 4 hours every couple of weeks dealing with PSI issues, so a lot less. It's been a lot more streamlined. But this will also come as, there's an RFP out for a new testing center, so we'll see what happens. The CC Bridge. Northwell is still providing classes. Enrollment has been up. So those of you that are still interested in bridging from CC to paramedic, I encourage you to do that. As of right now, the sunset date is still July 1st, 2027. I don't think there's an appetite to change that from the REMSCO. Even though that every time we meet at the REMSCO, somebody else wants to talk with us. This time, the Association of Fire Districts sent a letter to REMSCO asking to speak. If anyone knows John Manzi, he wanted to talk at September's meeting, talk about sunsetting of CCs. However, he had another meeting, so that has been postponed, and he'll come and speak to us in December, which is fine, because the further we get along and get closer to that date, the less people have an appetite to change that, right? And a lot of the areas or regions that have seen, that utilize CCs, have come up with plans to help mitigate the risk. I know in the county that I live, Niagara County has taken some public funding to sponsor CCs to take the bridge, which I think is absolutely wonderful. That's a nice easy way. The state also has some money potentially that they might be able to use from the training budget that's left over, help do that as well. So we'll see what he has to say. And then there was this other in May's meeting, there was this guy from, where was he from? South Country? Suffolk County, but was it South County or South Country? I don't know. They look like the army. They literally wore uniforms like the army, like the females that were in there, like had the army female like hats and stuff like that. I thought like the EMS army people were there to talk to us on there. Is quite interesting. He has 2 CCs in his group, by the way. One of them's a nursing student who's pregnant, doesn't have time to bridge, but also doesn't want to, not realizing she can become an RN and just challenge the paramedic exam. And the other one is like probably close to retirement age. It's actually beyond retirement age, but still there, but not really practicing. The other thing that we're looking to get from there, from DNI, at least from the training side, is to start to connect how many providers there are in New York State, how many show up on a PCR in a quarterly basis, how often they show up on a PCR, and what levels of care, so we can start to track how many of are actually active and how many trend out over a period of time to start to get a gauge of a true number of providers in New York State. There's somewhere between 70,000 that have certificates. Probably more likely like 30,000 of them actually provide care at some point. There's also 2 new education policies that are out. Policy 2406, which is requirements for the possession and production of New York State Department of Health issued EMS certifications. That supersedes policy 1205. And then 2407 is advanced EMS practitioner courses practical skills evaluation supersedes 2207. That's more along the lines for advanced life support. Also with the regulatory changes, paramedics will no longer have to go through a PSE from their agency. Not their agency, from the course sponsor, but they have to develop a plan to show proficiency in those skills throughout the course. So there will no longer be a PSE, which will probably start saving course sponsors some funds and stuff like that to help reduce some costs in some places. And then 2408, which is the education law that we already talked about. Collaborative protocols, work continues to be done. Any changes for 2025 will show up in December's meeting. Provided that there's a quorum for CMAC. Dr. Seth has been vetted finally, so he was there and able to vote. They actually, come to find out when you push them about vetting, they can actually vet people relatively quickly. Took Dr. Seth about 15 months to get through, but they're, have changed their process. So it's a secret process of how you get vetted. Nobody really knows. You have to fill out a couple of forms and then you don't hear from anything, and then you get a letter from the commissioner saying, welcome. Performance standards, they're still working through their way through the regulatory process. The hope is that they'll be done for December's meeting to come out for public comment. But more work to be done. Systems, 0606 is still a draft, still work to be done. And this will come as no shock. Ambulance offload times are once again a discussion. I know locally, if anybody's ever has been to ECMC in the last 3 weeks, I don't know what's going on there. I know some of it is staff shortages. But there's just massive amounts of people in the waiting room every day. And as the day goes on, it just gets worse and worse and worse. So, if you are experiencing long offload times, reach out to Lisa, reach out to Ed. They will do their best to help. Also highly encourage you to use the EMS agency to report long wait report that's out there. One of the things I'm gonna ask Rob or Zach, if you can add that link to the website there for agencies to look at and to use. But this is, once again, a discussion. There was a report done last year about wait times. Since then, those wait times have gone up. One would think that, you have a D&I team that you could just pull the data from the PCRs, but that seems to be moving heaven and earth, so they want you to fill out this form. But, it's one of those things where if you are experiencing those delays, there are looking, you can send it aggregate, so if you have, if you're sending 5 or 6 ambulances to place in the day and they're waiting at ECMC for 3 to 4 hours, just send them all together. You can send them aggregate. They'll take a look at it and start to work with ECMC and get the leadership to get to work in there. So that's the only hospital I know of locally that's seen issues for us. Catholic Health has a good system of reaching out to their liaison team to help move that. As Emily always says, if you see a bed, just take the bed. Just let them
Please
nurse
call us
there.
first.
Don't tell you to take it, but then just say, hey, just took this bed. And then, if you have any questions, I know at, Kayla Thorne's really good at getting back to people at Kaleida. Buffalo General is just kind of a crapshoot, good luck. But they do a pretty good job down there moving people in and out, so. Has anybody seen long wait times in places that are unusual?
Niagara Falls Memorial is becoming an issue again.
Is
I'm
Is
gonna
it-
be honest, there was under the bus, Mercy's been seeing really high wait times recently. We've got a lot of hold, so just, if you're stuck, give one of the liaisons a call before you decide to see if that day bed. Just give us a call so that we can kind of mitigate that, but Mercy, especially this week's been really bad.
But I think a lot of people and what Catholics do well is they let people know, like, hey, it's not pretty down here right now, right? Like, if you can try to go to another campus in our system, go to another campus right now. And that's all I think.
Lockport, Andy, because we're always great up there, so come we're always open.
And if you're on call center, we have been updating the availability levels at the hospital so that when you log into call center, you pick Mercy as a destination, it automatically lets you know you're leaving.
And with Niagara Falls, is it just a triage system
It's
again?
usually beds are open, they just don't give staffing.
They put themselves under burden without,
That's my favorite, like, we're on diversion, that's no longer a thing, you're open and closed.
Like they think because the CT goes down that you shouldn't bring anybody there. Or, the cath lab's down, don't bring anything here. It's, one night, I think all their nurses called off, so they had like I think they had ICU nurses down there, I think it was just last week, so.
It's nice.
And it was,
But sometimes you just wish those things could be communicated out, right? Like, just, hey, we're short staffed. Just so you know, if you come here, Because a lot of times patients start to get aggravated and they start taking it out on us, which isn't necessarily appropriate.
I can say Mary, the lockboard are open and available if you need it.
And we don't really.
Yeah, you know, I've heard of that.
I mean, there was a point in time in Winter Living School, what we used to do is that we bypass patients, bypass the ED and take the patient right to the waiting room. Maybe that's something to think about.
There is, I mean, depending on patient condition and stuff like that.
I mean, if it's something they can go, you know, just a quick, this is what's going on, you know, stuff total, bellyache, something like that.
Yeah,
I mean,
they don't have to sit on your truck, they go sit.
You know, you put them in the
It'd be no
wheelchair.
different if they drove themselves.
Right, it's, you know, it's something that's doing the TV now and then. I mean, maybe it's something we can do in. ECMC or.
Well, some of the things with ECMC is ECMC will try to tell you, they'll actually start treating the patient, they'll give them something, so then they'll say you have to watch them. That's still not.
Oh, I understand, but.
That's still not a problem.
So, I mean, to free up, I mean, maybe that's something to look into.
I was there 2 weeks ago, I saw Dr. McNamara there, and, there had to be, Brett, how many ambulances were in the, I mean, they were parked all over, it looked like a war zone.
Maybe parked against the wall.
Like it was parked against, I mean, it was insane, like ambulances were pulling in, people were pulling forward, and then ECMC was, cops were getting mad that you were blocking the road because you couldn't, there was no other place to put, there was just a line of people just in there, it was absolutely. So. Just.
Is there a way that this, I don't care what happens in ECMC. However, Strong had an explosion in front of their, and they also had, a few days later, they had a police incident in front of their ER. I put that out over our bricks, so, but is there a better way that we can, for those of us that transport to Rochester or Batavia, rather than Buffalo?
Yeah, well, I think it's just active communication, if you know what's going on. How? That's a good question. Some of it, I think, is sharing information. I think some hospitals are better at getting information out. to
I saw it all on top, you know,
Yeah.
I'm sitting there, watching TV news and, it was a steam line that exploded.
We got those by the way.
Did you?
Dispatch notified. Yeah, all the dispatch centers were notified.
That doesn't, you know,
So that way, when you call and Ralph Strong, they're gonna say, hey, be advised.
Yeah.
And it didn't affect EMS. You just had to go to one other entrance.
Yeah.
The next entrance over. They were still, it didn't close the EM. So it didn't, they didn't go code black.
they did for the shooting for a while. Cops all over with guns, so.
Yeah, but again, I mean, I'm sure that was communicated out. We've gotten communications on the steam line right away before it.
Okay.
So
A lot of it is
I
just-
think Erie County does a better job. I mean, it's all listed. If you look at the state hospital list,
Mhm.
there's a website that I got from Rob, I believe, back in the day. That doesn't accurately reflect it quick enough when somebody goes on diversion. But when you look at the Erie County site, they do a nice job, MERS does, of keeping that up. There used to be one in Monroe County. I don't know where it went.
I don't know, we can ask.
Cause I've searched online before it and I can't find anything where hospitals, cause they've had all these different colors.
Just the only thing I'll say about the Erie County one is,
What's that?
only thing that's good is just whoever picks up the other line at the hospitals to give them an accurate account for what they're.
Yeah. So,
For the most part, I think the liaisons, at least Catholic Health, do a good job of getting that information out, whether, I mean, I've been on, Emily's called and said, hey, don't bring a patient here, and you go on.
I did not say, don't bring patients. But it's not to avoid. Lisa, I never said don't bring a patient.
I think we're lucky, I think local hospitals are doing a great job, smaller one. The big one, it's janitor. So.
Right. EMS operations. Full service inspections are continuing. I don't understand this at all, but a lot of the main issues they're seeing is with expired equipment and medication. That's the easiest thing. Like, so if you have an inspection coming up, make sure that you reach out. and start, inspecting your equipment prior to the state getting there. When they arrive to go through it, that was not the time to inspect it. You should have inspected that prior to their arrival so that they can come in and say, yep, looks good, instead of saying, why do you have 47 things that are expired? Why is this broken? Why is there a whole bunch of garbage in your truck? And also make sure you review your policies and your systems before they arrive as well. That's kind of been a big headache for them. This is new staff is the theme for BEMS. Lisa's probably getting promoted already. Somebody probably replace her soon. But there's a lot of new staff coming in. Ryan said there's too many to mention, so he didn't mention any, but there's also promotions coming as well. So congratulations, Lisa. That's not quite good. Administration, there's an RFP process out for certifications. The system that they have is old and antiquated, and they're trying to update that, so hopefully it will match at least 2000s. So we can get our cards a little bit sooner and work through that. And then January 2025 will be the release for the schematron. So obviously reach out to UBMD and Rob and Zach when that comes out, and I'll help transition you guys through that. Under trauma, the next stack meeting is October 30th. The iGel pilot project a motion was made to continue on with that. The Bureau is going to work on a policy to integrate that into if equipped and trained, similar to the check and eject, BLS 12 lead, all that fun stuff, albuterol and epi for respiratory breathing issues. So that still continues. The project is still accepting new members if you're interested in that, but you still have to follow the full project pilot until the policy comes out. No guarantee when that policy is going to come out. From the finance committee, the EMS workforce shortage report and charts will be available hopefully this week. I know Ryan and Steve Kroll were working on finalizing that. Those of you that are core sponsors, keep spending money. The more money you spend, the more money that can be requested for training and ed. So last year we used about 50% of the budget. This year we're about 25% higher of a $10.7 million budget. Probably won't use it all this year, but the goal is to try to spend to that budget so we can ask for more and get more in the future. Safety, the mental health guidance document was approved and is now available. I'll send that to Zach and Rob for them to send out to everybody in the region later tonight or tomorrow. Please use that guidance document. It's a good document that will talk about how to deal with the mental stressors of the job. We're also working on a restraint policy. There is no policy in your state as it comes to restraining patients and how to integrate that in with law enforcement and everything else. Dr. Isaacs from FTNY is leading that tag. If anybody's interested locally in working with that, please let me know. I'll get you in contact with him. We hope to have that completed probably 2026, 2027, quite honestly, because of the amount of work that needs to be done. And then we held a tabletop exercise during the safety committee meeting. OSHA changes. We talked about in our last meeting, that has kind of hit a standstill. There's been some people that have been outspoken about that. They pushed the public comment period back twice, and then it's been eerily silent. If I was a betting man, I doubt those changes will be approved before the first of year or until Biden's term is up in January. But then again, it's the federal government, you never. Vital Signs is October 24th. It's in beautiful sunny Rochester. October 2024. Next month. I don't
Through the 20.
Yes. If you're interested, registration is open. The EMS Memorial was held last Thursday. For those of you that don't know, or can't make it out there, that ceremony is live streamed. The memorial itself was updated and upgraded because unfortunately too many EMS members have died in the last 20+ years since the memorial was out there, so it was outgrown. What they have now is they have a big concrete wall and they have the leaves of life coming off the tree. So when somebody goes on, they're engraved on that leaf. They stay on that leaf until they need to be removed. Then they are then engraved on the wall to stand there forever. There was a committee that was put together. They did a phenomenal job putting that together. And every year the Bureau does a good job of putting the memorial together. This past year, there were 8 members honorees that went up on the wall. 7 of the 8 were from FDNY. that had some form of 9/11 related illness. And one person was from Goshen. I don't know where Goshen, New York is, if everybody else does. Goshen, sorry. I don't know what happened to her, but she passed away in 2018. Program agency report, Zach.
So, thank you. So this is my first time, so, a lot of things on here that I won't cover because it'll be just repetitive. So number of informational notices and training notices were sent out, many of them prior to when I started. But, since the last time, since early June, I can go through them all if you'd like, or they're all listed on here. The informational side, job opportunity, construction updates, credentialing deadline, road construction, vital signs, job opportunity for the research, sponsor application survey. There was a CME event that was canceled, another job opportunity with ECMC, new hire, that was me. For road closures, a paramedic review session, some additional information on that went out. Air reserve base, there was a gate update. The award nominations, I think that was something that Emily spoke about earlier or wanted to speak about. The DOH policies, and new DOH policy that came out during last week at the REMSCO and CMAC meetings, Rob got that sent out. The legislation signed by the governor, and then up through recently, items about the ET3 survey. So that was on the informational side. On the training side, we had various Vital Signs Academy items that went out. New thing as well is the NEMSIS 3.5 educational SNP. Those are various notifications that went out. They're items created by the state, the data team. They'll be sending out periodically. Additionally, in training, Catholic Health offered geriatric CME, REMAX skills sign off. There was an EMT course at East Shelby, and another one that was held at Damon. CME opportunity with the Catholic Health, as well as a EMT class from the city of Batavia. Paramedic student review session, there's some information about that, training about that. EMT class at, sorry, it says Niagara triple N trip, but it should be SUNY Niagara. September CME in Niagara County. The CCEMTP course. CIU and CLI course offerings, stroke class at Bliss FD, as well as a New York State CIU course posting for Erie County. So that was all as of Monday, I believe. Skip ahead, agency updates. I kept this on from the last version, but if there's any updates, please remember to update the Bureau VMS with the forms, DOH 2936 and DOH 5127. And obviously, if there's any questions, please feel free to reach out to myself. And if I have questions, I'll ask Rob. PCR data. There was an item on here from, again, last time saying not allowing extensions, which means if your vendor has not transitioned your agency yet, and this was, I believe, to the 3.5, your agency is subject to a statement of deficiency. And those of you that are using the state system, those are transitioned automatically. Going down, again, the collaborative protocol, the one thing I'll add to that is those protocols that did go into effect. If you are use the Muru app on your phone, if you're an Apple user like I am, you may need to force your app to update it if you haven't already. Sometimes the updates do hang up from the server. The other item I'll mention is the recruitment and retention. As was mentioned, topics came up at the state meetings and various committees, as well as at the larger meeting. There's some funding that will be made available once contracts are settled and signed and created, all that stuff through the state. But essentially, the program agency will be receiving funds to help distribute through the region. And that will be specifically dedicated to recruitment and retaining members. There is also a paramedic program funding, and that's also funding that would go through the agency, I believe, per the region. The region would need to fund a minimum of 2 paramedics in a new course. This is the EMS task force that was created. This is the program that the state has come back with saying, hey, we will help fund to replace those positions that were hired. And that's really everything else. I think everything else is covered.
Thanks, Zach. Zach alluded to, we've talked a little bit before about recruitment and retention money coming from the state. That money is earmarked in the program agency contracts for them to work with the agents to spend, is it 15,000 for recruitment and retention and 20,000 annually for, is it just one time for paramedic?
Paramedic scholarship, so the rule, the minimum rule is that you have to fund 2 students to go to a paramedic regional course. So if the course is greater than 10,000, then you're gonna fund up to the $10,000 for each student. If the course is, say, 5,000, then technically you can fund 4 students if you want, but you have to fund 2 students at a minimum.
So, that money is tied into the program agency contract. That doesn't come to the REMSCO directly, but it's used in conjunction to how we direct the program agency to spend that. So as far as the recruitment and retention money, we're gonna pull back the recruitment and retention committee. Terry Thompson is gonna chair it. So those of you that are interested, please reach out to Terry and work with Terry and Zach on that. And then Sarah is gonna have to develop a paramedic template for us to sponsor 2 paramedic students in the very near future, or at least give us a baseline of what she thinks is appropriate. This will come as no shock. I'll speak on for UBMD at this time, for the program agency. They're without a contract in the state right now. They have completed everything. It's just, they're not the only one. All the program agencies across the state have not received their funding. There is no idea or no timeframe when they expect to receive their funding. But they continue to serve and do the things that they need to do based upon their contract, and hoping they'll get their money at some point. What also becomes a problem is the recruitment and retention money. That recruitment and retention money is a 15K spend. More than likely, by the time that they get the money, it runs on a fiscal year, and the fiscal year runs 6/1 to 5/30, correct? Something along those lines.
It runs to 6/30, 7/1 to 6/30.
So we are now 2 months, we'll be 3 months into it. We're probably looking at 4 or 5 months before that money comes in, which means how do we spend 15K in X amount of time? Because we have to go through the process and everything else. The good news is the way it was written for us going forward is that this isn't a one-time gift or spend. Is that this will have years of 15K come into each program agency for us to use. So if we're not able to use it all of it this year, the hope is that next year we'll be able to use it all. But it's always incumbent upon when the contract's executed and when the funds are dispersed. Unfortunately, those funds don't carry over year to year either. So, you know, we might get 15K to use whenever UBMD gets paid. But we have to wait till at least to get paid to start using some of it. They get paid in May. We probably can't spend 15K in 1 month. I know some people that probably could, that like to use Amazon, but other than that. So we thank the program agency for continuing to serve us in this time without their funding, and then we will support them in return. So if they need anything from us, I just want to let you guys know that we'll stand up on their behalf to make sure that they get the funding. Sarah, training and ed.
We did not meet over the summer. Probably won't meet for October because of vital signs and things like that coming up, so we'll probably be meeting again just before the holidays, so probably an update for next.
Excellent, thank you. Bylaws, Dave.
Probably start working this fall on the updates we talked about, and we'll start that process up this fall.
Sounds good. Rick, any other CLN?
Well, actually, we have an application being submitted for review before the actual submission of the application. They want to review it first and then figure out what they need and gotta get. So kind committee after the meeting, we'll sit down real quick and just briefly take a look at it.
It's Alexander Fire Department. They split their ambulance service off years ago. They just want to move it back to the fire department. So
So is this just a transfer then?
just a transfer. So
And then awards there, Sarah.
No updates.
If anybody would like to join the committee of Sarah and Flora, please reach out and let us know. I'm sure Sarah would be more than happy to have some fresh faces on it. Lisa, DOH report?
Just the usual reminder to everybody to please use the portal. We use it for literally everything. We do not accept regular mail anymore. You can even use it if you have a complaint you want to bring to our attention. We now have a portal for that. And like Andy mentioned, a lot of movement within the bureau. I do have the Southwest region open at the moment. Technically, I've taken it for the time being, but we do have that person to replace. I will probably need replacement at some point, so if you're interested, check out our website. We're always posting.
Those of you that don't know, Don promoted into not Homeland Security, but
Agency and
Yeah.
Certification and licensure.
So-
You have to leave it.
When I know.
And Ed's on vacation, so Lisa's by herself right now, so. I mean, Ed's always on vacation, but. Does anybody have anything for Lisa? We rather have Lisa here than Ed in. Dr. Seth, do you have anything?
No, I think, nothing major. He's covered most of the CMAC stuff. Yeah, I think that's sort of the big news for me. I think the only other thing that we didn't talk about was sort of some of the things that were coming down from med standards. So some of the things that are kind of in the pipeline, like, replacing olanzapine. They're gonna move nitro back into, advanced EMT level, for pulmonary edema. They talked a little about the antibiotics, for open fractures and amputations coming, and adding nitrotropium to all levels. So it's just a few little things that should be coming out, you know, I don't know, 2030, 2045. The major things that you covered, the IHL project and the blood.
Thank you. Does anybody have anything for Dr. Seth?
Doctor, I do. Doctor, can we get a push to transporting the blood? I mean, I realize nobody here is gonna have the funds, probably, maybe A-line, to have blood, but I mean, transfer wise from small facilities to the cities. If we can push Wadsworth into like 2 different streams on this, carrying the blood and then transferring of the patients. And get that going. I know Strong had talked about it on their end, that they were making a push. And he said, you know, you'll see it very quickly. And as far as we're concerned, you know, quickly, it's relative, right, New York State quick. So yes, with the law getting signed now, I think it's quick.
Yeah, I mean, I think, you know, the evidence is there to suggest that it's useful and potentially helpful. There's a big cost to running it,
Right.
a literal human cost.
Right.
And
It's the
so,
number one, I mean, outside of human resources and paying your employees, it's the number one cost.
Mhm.
And that was 10 years ago, we did that study, so at least. And so, I mean, we're just talking about transporting patients from point A, little hospital to big hospital. And, you know, we just want to see that get pushed through.
yeah, no, I agree. I think we're gonna be at the sort of the mercy of the state to, put it all together. But yes, the short answer is yes. I noted that there's support in the big lakes area for the project.
Yeah, I don't think we'll have any problem in this council supporting
No.
that.
And I might even put a little birdie in the ear, so Dr. Seth maybe share a tag or something like that.
Oh.
Because usually what happens if you open your mouth there, they make you do something, so.
So I just want Wadsworth to understand there's 2 different channels here. You know, we're not looking to take from their blood supply. We just want to be able to transport the patients, you know, instead of them having to sit there in these hospitals that are an hour or 2 hours away. Well, they're getting on a rapid transfuser or a regular transfuser and, you know, time's ticking away.
Yeah, you don't need to send a nurse with them there.
No, and let's go.
Agreed. Does anybody have anything else for Dr. Seth?
And so the only thing I would just say to that point, that's to the point that if there are issues that come up between now and December 3rd or 4th, that you want me to patch back or that I can, you know, help channel up the chain, feel free to reach out.
Awesome, thank you. And the one thing I want to mention, Dr. Jeremy Cushion from the Melrems region, was his last CMAC meeting, last week. He served 15 years on the CMAC. Was a great contributor to the collaborative protocol and a lot of positive changes in EMS. Sad to see him go. Dr. Maya Dorset will be his replacement. So we're excited to get to work with her. But sad that we lose 15 years of Dr. Cushman as an advocate for EMS. Emily, what do you have for ethical?
Mercy Hospital will be holding our annual EMS recognition dinner on November 13th. Call nominations are due by October 2nd. And crazy this year, we don't have very many call nominations, so if your agency had a great call this year, please submit it. It is not a requirement that they transport it to a Catholic health facility. We're just looking to recognize the great calls. UBMD did put that out, so thank you guys, and Rob's gonna put it out again, just so that you have the letter and you have the nomination. We have a dialysis CME class tomorrow at 7 o'clock at Niagara County Public Safety Building. And we will have a Pulsera informational meeting on October 7th at 7 PM at Tri Communities Indicon Drive headquarters, what you guys are calling it. The Pulsera rep will actually be in town, so if anybody has any questions or they want to come see a demo, or if Sandy wants to come talk about how great the program is, as one of our super users, that will be open to anyone. We will be putting a flyer out for that as well. And just to kind of piggyback off of Andy's discussion about this late offload times, again, if you're at a Catholic facility, please contact one of the EMS liaisons. We will either get you a bed or we will squash the fire when you see a bed and take a bed.
Thank you.
And Mount St. Mary's and Lockport is open.
It's open.
Quick turnaround and food.
Does anybody have any questions for Emily or Amanda? Don't ask Rob any questions. We'd like to get home relatively soon. Old business, I know we talked about this before, but does anybody have any thoughts on sunsetting of CCs or, you know, I think the stance that we've all kind of seen the writing on the wall. It's not so much that it's a bad certification, it's just the educational requirement hasn't been updated in over 25 years. Which is a problem, right? And, you know, back in 2017, when they started this discussion, they were supposed to put a firmer date on it. At the time, they didn't, because they were concerned of trying to tell somebody, you know, somewhere that they couldn't do it, that has a lot of money, that can try to bully somebody into doing something that they want done. So I think there's enough people that are on there. I voted in favor as a REMSCO member to sunset CCs. I think at the time has come, my personal opinion is I think in New York State, we should have 2 levels of care, EMT and paramedic. And you pretty much all the life-saving interventions that you really need, or have already done at the EMT level for the most part. And especially with the iGel project for the BLS providers, you know, you have an airway adjunct there already. So, the only thing with that, if you do the iGel, I forgot to mention, is that you need to buy continuous capnography. Dr. Tiffany Bombard says there's a few things on the internet that you can buy for like $1,000 to $1,500 that will do the continuous waveform for you. You don't have to buy a $10,000 or $15,000 machine to do that. And then I talked with Zach this morning. We're going to continue on with Mike not being here, but we're going to continue on with the regional spotlight campaign that Mike and I started previously. So we're going to continue to do that. Does anybody have anything under old business or moving new business? All right, new business. One of the things that we did at our safety committee meeting was to talk about doing a tabletop exercise regionally for all hazards event. It doesn't have to be a snowstorm or a rainstorm or a hurricane or an earthquake, but just putting together a tabletop so agency leaders know where to go to request resources, how to get a hold of people, where they need to go, and trying to create a line of communication. So I talked with Jonathan Schultz about that earlier before the meeting. John and I are going to kind of work on putting something together, hopefully for 2025. And that will be part of our meeting going forward. And then lastly, this pains me to do this, it's such a pain in the ass. But we have to read these New York State BEMS enforcement notifications. I will just read the names. We will have whatever they did we just have to read them out loud in the public record. Name is Chief Vinson, James Wilkinson, Luis Carrillo, Andrew DeWolf, Yvonne Day, Harold Serrano, Amanda Yugi, Brian Torres, James Schofeld. This is like second or third time getting in trouble. Kayoko Sato, Benjamin Miller, and Gary Braditzik. We'll have everything that they did. They're all part of their violations except James. He got in trouble and did something else that he wasn't supposed to do there. He got in trouble for. So
Maybe from anywhere around here.
No, I don't think any of these guys were. Not that I know of. I didn't, most of them are downstate in New York.
Oh, that's where most of the EMTs are.
Was that? Oh, it was anyone around here. I don't think any people I just, not this week, but not like. Our next meeting will be November 20th in Orleans County. I believe it's at Ridgeway, but I'll confirm. I think we're all set up there, but I will set out the location as we, the next couple weeks. Can I take a motion to adjourn? Second, Bob. All in favor? Thank you, guys. Thanks for coming. I really appreciate it.